The idea that being transgender or nonbinary is a mental disorder is being relegated to history. Major medical institutions have transitioned away from viewing identity as something to be cured. A person's gender identity is a fundamental part of who they are, not a clinical pathology. This creates a confusing paradox. If identity isn't a disorder, we have to ask why medical manuals and insurance providers still depend on a formal diagnosis called gender dysphoria. This confusion carries high stakes. When we fail to distinguish between a functional medical label and a person's character, we allow a clinical term to be used as a tool for social stigma. When identity is mistaken for illness, the result is an environment of judgment that complicates the lives of trans and non-binary individuals. This stigma creates a functional wall, discouraging people from pursuing the therapy or medical support that would improve their quality of life. Moving past this barrier requires a clear distinction between who a person is and the specific distress they may be experiencing. Gender dysphoria describes a specific clinical reality, the acute distress that occurs when a person's assigned gender at birth and their true identity clash. It is a diagnosis of the friction, not the person. As this diagram shows, the core identity remains intact, while the diagnosis targets the pain caused by the mismatch. This friction often intensifies under the weight of societal judgment, adding external pressure to an already difficult internal experience. This constant state of pressure explains why we see high rates of anxiety and depression alongside dysphoria. These are the psychological results of sustained, unaddressed distress. Because this distress is a documented medical reality, the diagnosis provides the necessary framework for doctors to provide professional care. In practice, gender dysphoria functions as a technical requirement within the modern healthcare system. The diagnosis works as an administrative tool. It is the specific mechanism that requires insurance companies to authorize and pay for various forms of care. Without this terminology on official paperwork, the affirming and respectful care a patient needs often remains financially or legally inaccessible. This classification serves a protective role, acting as the primary vehicle for securing a person's right to healthcare. Targeted, supportive care has a proven track record of reducing this distress and helping people thrive. Affirming care means working with a therapist who has no interest in fixing your identity, but instead focuses on understanding it. This involves steady support through the social or medical transitions an individual chooses for themselves. Effective therapy addresses the stress and mood issues caused by dysphoria, rather than questioning the validity of the person's self-knowledge. Coping and Healing Counseling, or CHC, was built to provide this specific type of agenda-free support. Their team includes more than 15 licensed professionals, including clinical social workers and marriage and family therapists who specialize in culturally competent care. Through HIPAA-compliant telehealth, they provide services to every one of Georgia's 159 counties. To keep this care accessible, CHC accepts Medicaid with a $0 copay, while private insurance costs like Aetna or Blue Cross Blue Shield typically range from $0 to $40 per session. The diagnosis exists to ensure you get the support you deserve, exactly as you are. You can find out more at chctherapy.com or by calling 404-832-0102.